Thank you, Madam President. I rise to discuss the Democratic continuing resolution proposal that was on the floor earlier. Neither proposal gained sufficient votes, and that means we have work to do to find a compromise that will enable government to stay open. And I want to make clear why I believe the Democratic proposal has some real strong merit for Virginians and for members of this body, both Democratic and Republican, and why I think it's such a strong proposal. And my advocacy for the Democratic position is basically focused on two issues: health care and the underlying basic notion that we all get that a deal should be a deal. During August, I think, as most of us did, I traveled around my home state of Virginia a lot and talked to many people. The Senate had passed the reconciliation bill, that partisan bill, in July, and during August recess, I heard a boatload from Virginians about their concerns. Because of that reconciliation bill, 6 hospitals in Virginia are at risk of closure. These hospitals are all in the rural parts of the Commonwealth. 302,000 plus Virginians will likely completely lose their health insurance. 136,000 will lose the health insurance that they're currently able to access through the Affordable Care Act, and another 166,000 will likely lose health insurance because of cuts to the Medicaid program. Virginia has a population of about 8.5 million. 302,000 people losing their health insurance is pretty significant. Those who continue to have health insurance will see significant premium increases. According to the State Corporation Commission, which is the body in Virginia that regulates industries like insurance companies, the 10 insurers that participate in the Virginia individual market in 2026 have requested rate increases from their 2025 rates, with most insurers proposing average increases of 20% or higher. What would that mean? The Kaiser Family Foundation says a family of 4 with 2 adults age 50 and 2 kids under 21 are likely to pay an additional $311 per month or $3,729 per year because of the reconciliation reduction of ACA tax credits. Virginia stands to lose up to Virginia hospitals stand to lose up to $26 billion in Medicaid cuts over the course of the next 14 years because of the reconciliation bill. And that is the reason why a number of rural hospitals that are sort of on the edge in terms of their financial situation are on a list of concerns about closure. And Madam President, just within the last 2 weeks, we actually had the first closures in Virginia. A well-respected healthcare network in the Shenandoah Valley that has a hospital in Augusta County, but then has primary care clinics sort of throughout the region that serve patients who can be served there instead of the hospital, announced that 3 of the primary care clinics are closing, and the CEO of the healthcare network said closing because of the Medicaid cuts made in the reconciliation bill that this body passed in July. I also heard a lot of stories just from individuals. These are the statistics about what is going to happen in Virginia because of the reconciliation bill, but we talk to constituents all the time. Mary from Springfield, Virginia, in Northern Virginia, and Kim from Mecklenburg County on the North Carolina border both have children with disabilities who rely on Medicaid for access to care to allow their children to remain in their homes instead of in institutional settings. These moms are very worried that Medicaid cuts won't be available for their children's long-term care. Brenda is a mother in Salem, Virginia, near Roanoke. She relies on Medicaid to help her remain in her home and not have to be institutionalized, and she worries that the Medicaid cuts will cost her access to the supports that she needs. William in Virginia Beach, Virginia, on our eastern coast, says that his son has marketplace coverage, but is worried that the cuts to the ACA premiums mean that the son will no longer have access to that insurance now that the reconciliation bill has put those premium subsidies on a path to expiration. Maria works as an employee of affordable housing community for seniors in Fairfax, right here in the D.C. area. And she said that since the passage of the reconciliation bill, she's seen a growing number of low-income seniors come into her office frightened that their Medicaid coverage will be reduced or terminated. Sharon lives in Lancaster County, which is in a part of Virginia called the Northern Neck near the Chesapeake Bay, and she's called to ask my office if Rappahannock General Hospital was in jeopardy of closing due to the reconciliation bill. Rappahannock Hospital, a facility I know well because my in-laws lived right there in Lancaster before they passed away in the last couple of years, is one of the 6 hospitals that is listed on national lists as a hospital in jeopardy as Medicaid cuts phase in. And then finally, Caroline from Lynchburg, Virginia, in Central Virginia, has had coverage through the Virginia Marketplace and is concerned that she'll no longer have access to the tax credits and subsidies that have helped her afford health insurance. These are just 7 examples of citizens from all over the Commonwealth who the reconciliation bill, I read the big statistics about it, but these are individual families who have significant challenges. What the Democratic CR proposal does is something that many Republicans in this body have said needs to be done, that in the aftermath of the reconciliation bill, we're hearing similar stories from our constituents, and that we need to fix especially the ACA premium support so that people do not lose health insurance. And we also need to fix some of the Medicaid cuts that cause the concerns that I've expressed from these 7 individuals. My visit around Virginia in August sort of made me see this health care concern as sort of a spectrum. When you make cuts to Medicaid or to these premiums, 5 different things happen. People lose health insurance. Those who retain health insurance see their premiums go up, often because the folks without insurance go to the emergency room. That's more expensive care. It has to be paid for, and that tends to assist in driving up the premium cost of those who retain insurance. Third, as I indicated, has already happened in Virginia, providers close. And when providers close, there's a 4th effect, which is people lose their jobs. And then the 5th effect is one that I think we should talk about as well. It's not just people losing health insurance and having their premiums go up and seeing their providers close and seeing healthcare professionals lose their jobs. There is a 5th effect. I was a mayor and I was a governor, and I did a lot of economic development work in Virginia. And I know that one of the things that businesses really care about if they're looking for places to locate or expand is what is the local availability of health care. It is really difficult to be in a community and try to pitch an economic development project, but have the question asked, tell us about your hospital, tell us about your health care network, and to explain that we had a hospital but it closed, or we've had health care clinics that close. That makes it very, very difficult. This 5th effect is an economic effect. The decline in healthcare clinics and hospitals actually is sort of like a theft of a community's future, because it makes it very difficult to get people to come. And so that's why I think the Democratic proposal is a solid one. And I do recognize that in the aftermath of the passage of the reconciliation bill, many Republican colleagues, both in this chamber and the House, have said that it is important to come back and fix particularly the expiration of the ACA premium tax subsidies. And I think that would be a very smart thing for us all to do. Finally, Madam President, there's a second reason I really like the Democratic proposal, and it is this. A deal should be a deal. And the Democratic proposal has some components in it that would ensure that when Democrats and Republicans in the House and Senate reach a deal that goes to the president's desk and he signs it, that the president then can't immediately take the money away unilaterally. I think everybody around my Commonwealth, Democrat, Republican, Independent, or the vast majority that don't really care that much about politics, they get that a deal should be a deal. When you negotiate and you shake hands, a deal should be a deal. And this actually is related to health care as well. In last year's budget, we had a deal about spending on health care priorities. Early in this administration, the Secretary of Health and Human Services, Robert F. Kennedy Jr., announced that he was clawing back billions of dollars of health care funding. To Virginia, it was $400 million. $400 million of health care funding that we had planned on using during the worst increase in measles, for example, in recent years, got clawed back from Virginia, and 500 workers and contractors lost their jobs as we were trying to deal with measles and other health epidemics. I have communities in Virginia who had had economic development projects announced, and they were counting on them for their future. And often the announcements were attended with great fanfare by our governor, Governor Youngkin, who was a Republican, who believed these economic deals were good things, and they were reliant upon funding from the Inflation Reduction Act or from the CHIPS manufacturing bill. But those funds, in many instances, have been clawed back. A deal should be a deal. When we reach a deal, it should be honored, so that communities do not plan for healthcare workers, do not plan for economic development projects and feel the rug pulled out from under them. And so those two features of the Democratic proposal, fixing some of the health care cuts in the reconciliation bill that even by many Republicans' accounts have gone too far, that have already led to closures of clinics in Virginia and great anxiety among individuals. We can fix those, and we can establish a principle that should be one that we would all agree on, that a deal should be a deal. I hope as we grapple with the two proposals on the table, neither of which were able to get 60 votes and be passed, we can take some of the wisdom in these Democratic proposals that would serve Democrats, Republicans, independents all over this country and make sure that we include them going forward. And with that, Madam President, I yield the floor.